Hey everyone, welcome back to another video. I hope each and every one of you are doing great and having a positive outlook on life. Today, let's talk about clinical electives and attachments in UAE. So, as a medical student, you might have been exposed to clinical rotations while at your clinical years, and this clinical rotations would allow you to get an in-depth insight about the patient workload, the department, the system, how they follow the inpatient care, for example, the procedures, the examinations in the wards or in the procedure room, etc. Most medical schools would have a fixed number of weeks allotted for a clinical electives or a clinical attachment to be done as a mandatory requirement. But however, this does not mean that you get restricted to that particular number of weeks in getting experience outside your medical school. Clinical electives or attachment is something that would allow you to get in-depth insight apart from your medical school. For example, it could be a different country, it could be a different hospital, it could be a different organization. This will allow you to gain experience so that you know how the healthcare system works in different parts of the world. My college requested us to complete at least a minimum of 4 weeks of clinical attachments. This might vary on different medical schools across the globe. Completing these requirements is just a process of getting your degree validated. But apart from this, it can also mean that you get the relevant experience in the field that you might choose as your residency career in future. Moving on, let's discuss the clinical attachment system in the United Arab Emirates. And I would just give you some tips on how to get through a successful clinical rotation, be it in any hospital. Now, the general procedure of applying for a clinical elective is to approach a teaching hospital. The idea simply being that the hospital itself ensures that you are particularly fitting in that department, and it utilizes the time you spend over there in which they teach you theoretically and practically with hands-on experience. For example, if you were supposed to go into an internal medicine department in any hospital for a clinical elective, the way you look at the department would be meeting patients, going for morning rounds, or getting insight on how the doctors or the team manage patients. You would rather be focused on understanding the hospital system in order to gain your experience in that relevant field. Be it simple cases, be it chronic cases that you would be seeing either in your hospital, or be it some rare cases that you might have not encountered before. So you would get a cumulative experience that would be worthwhile. But if you were to apply for electives in Dubai, you could be applying in a government hospital or the hospitals that come under the government portal. This would be either doing electives in Dubai Hospital, in Rashid Hospital, in Latifa Hospital, and so on, many other hospitals. The unified system for this is to apply on the government portal. Now, the government portal allows you to book a slot for your elective month. This process is generally paid, and you must refer to the website to know more details about it. However, if you were to look at alternative option in Dubai, you could be applying to many other private hospitals that have turned into teaching hospitals right now. One of the examples is Dr. Sulaiman Al Habib. This hospital has started giving medical internship programs and also medical electives to students and to recent graduates so that they can gain their relevant experiences. Similarly, in Abu Dhabi, you can also apply on the official government portal, which will allow you to book the available slot in the department where you want to do your electives or attachments in. However, I would be mentioning the details or the links in the video description so you can have a detailed look at it at the end of the video. Now, since this is clear, let me enlighten you on a few things that you need to know before doing your clinical elective month. First, if you are a foreign medical graduate or if you are a student who is visiting the hospital for your elective month and staying elsewhere, you must always make sure that you approach the hospital to know about their accommodation and transportation services if they provide or not. Because if they do not, then you have to bear the expenses yourself. Second, make sure that the hospital you're applying for is a teaching hospital and not otherwise. Third, you ask the HR to give you a completion certificate once you complete your required weeks or the time spent in your elective month. Make sure that they mention the time period that you have spent in the department. Fourth, the period of time you spent in your clinical electives is a very good way to network. For example, if you were supposed to go abroad from your medical school and you were to do your elective month in that particular hospital, you could meet doctors from various specialty. They could be either residents, specialists, GPs, or even consultants. They would be guiding you through how the system in that hospital is working and how, if you would look for a residency career in that hospital, would benefit you. Make sure that you do electives in hospitals in departments that you would want to choose as your residency career. If you were to look at emergency medicine as your future career, then you must try to spend your elective months doing emergency medicine rotations in various different hospitals. First, this will allow you to get recommendation letters from doctors when you complete your elective month. Second, doing electives in these departments will allow you to mention them in your CV, which will add as an experience. 6, always plan your elective months in advance. Well, it can be as simple as you going out on a holiday. For example, you would want to go to US, UK, Canada, any other country in the world. But if you plan your elective month before going to that country, you could be a doctor by the day and a tourist by evening. So this will allow you to enjoy life as well as get a learning experience on the same time. I hope these tips were quite helpful for you and it might solve a lot of queries in your mind. But if there is anything, please feel free to write it down, or you can even text me up on my Instagram and I will try to get back to you as soon as possible. Also, I'll be uploading the latest updates on my Instagram story, and don't worry if you miss it, I will still add it up to my Instagram highlights so you can check it out later as well. To know more about me, you can watch my first videos. It will come up here, and I hope you all have a great day. Take care. Bye-bye.